Well, the first thing to remember is that menopause can be a really big issue, so you might need to actually book 2 appointments and start with their initial concerns and then bring them back to go into it further. We like to use really open-ended questions and give the woman a really good go at airing all of her concerns before you get in there with a whole bunch of questions. When you're establishing the diagnosis, really it's all about what's happening with their period. So make sure that's one of your first questions, and also focus on what her main concerns are. Menopause is really a clinical diagnosis. It's based on the history. So if you've got a woman of the right age, so around 50, who's experiencing oligoamenorrhea, so periods of increasing length between their periods, or who's not had a period for 12 months, then we can determine that they've got menopause. You don't have to have any further investigations, but you may need them if you're worried about a more sinister underlying cause for their symptoms. The main thing is to be non-judgmental and listen with open ears, and use open-ended questions. So you might even start with, so you think you've got some menopausal symptoms, what can I help you with? And just give them a couple of minutes to just describe all the things that they're worried about. There's really 2 major groups of symptoms that women are often a bit reluctant to bring up, but are usually quite happy to talk about if you bring it up. The first group of symptoms is sexual symptoms, and this can include classic symptoms like vaginal dryness, and you can just ask women, do you have vaginal dryness? Going along with that is painful intercourse, and often women expect that intercourse is going to be painful and they don't realise that it doesn't have to be. So often you have to actually ask that question rather than waiting for them to bring it up. Going along with that is also low libido, which can be quite an issue, particularly if they've already got vaginal dryness or are having pain during sex, and this can be a concern for a lot of women as well. The other major group of symptoms is mood symptoms. We know that menopause is a time of vulnerability for depressive and anxiety symptoms, so it's worthwhile asking women how they're feeling in themselves, if they think they're feeling down or more anxious than usual, and if you're concerned, then asking about things like alcohol intake as well, because we know that if women are feeling particularly depressed or anxious, they're much more likely to be binge drinking. It's really important to look at the whole woman, not just at her menopausal symptoms. And it's important to remember that women at midlife are often really the keystone to the whole community in a lot of ways. So they're often looking after children, they're looking after parents, they're working, they're managing their household. So they often have multiple stressors in their lives at the same time, which can be really important for their health. The other really important thing is to try and use this as a midlife health check, because if we can intervene early when women are in midlife, perhaps we can stop problems occurring when they're older. So looking at things like their cholesterol and their heart health and their blood pressure can be really important. It's a really difficult question because there is so much information on the internet about hormones and not all of it is evidence-based. And I think that's because there is such a need for information and women really want information, which is a good thing. But often they come in and they've got lots of preconceived notions about the type of testing you might do, so they're often keen to have saliva testing. They've often researched a lot about bioidentical hormones or herbal therapies. And it's really important to be open-minded and non-judgmental and just explain that you take an evidence-based approach and what things you're prepared to use and what you're not prepared to use, and why or why not you might use certain investigations. And if someone is really keen to take a natural approach, then there are some things that can be helpful, and if you're not comfortable using them, then perhaps recommending somewhere else they can get that information. So before starting hormone therapy, the really important thing is to screen for any contraindications. So this is really asking if a woman's had breast cancer or other hormone-dependent cancers, or asking for a history of deep vein thrombosis. The other things you might be considering are a history of cardiovascular disease or strokes in particular. And then you want to be looking at, have they had appropriate screening such as mammograms, pap smears, and looking at their health in general. So are they a smoker, because we don't like using in smokers, are they obese, and looking at those sorts of factors and addressing them before starting hormone therapy. To assess symptom severity, you can either just use standard history questions, so that might be looking at hot flash frequency. So how often are you getting your hot flashes, how severe are they, the impact they're having on the woman. For example, some women find that they're having to carry a spare change of clothes in the car with them because they're sweating so much. So you'll be wanting to ask that at a follow-up consultation if they're still having to do that. There may be other symptoms that were more important to them that you need to follow up as well. So you can either just use a guide to how they think they're going, and alternatively you can use validated symptom scales and look at the symptom scores before starting therapy and 3 and 6 months after starting therapy to have a more objective measure. We know around 1% of women go through menopause before the age of 40, and although the symptoms are quite similar to women who go through menopause at the usual age of around 50, it really is a whole different ballgame. There are a whole lot of other issues involved. For example, fertility is a really major concern, and if women are wanting children, it's often important to consider early referral to a fertility specialist so they can at least discuss their options. Psychological health is often really important around this time as well, and it's often a very devastating diagnosis, and women require a lot of psychological support. Because of the issues involved, often you will need to have extra time so that you can really listen and support women through this diagnosis. It's also really important that women do receive specialist care as well, because there are certain conditions that may cause premature menopause, and often this requires specialist testing. And we also recommend that for nearly all women who go through early menopause that they go on to hormone therapy until around the age of 50. And this is to protect their bone health and their heart health, because we know that women who undergo menopause very early do tend to suffer increased mortality due to heart disease. It's also important to remember that hormone therapy in young women is different to hormone therapy in older women, and it's really important to address women's concerns around this. So it's important to explain that most of the research so far that has found adverse effects of hormone therapy has been conducted in much older women who are 50 or more, whereas in younger women we really do think that hormone therapy is beneficial for their long-term health and in fact life prolonging. When women go through an early menopause after cancer treatment, often their symptoms are very severe, and it's really important to address these symptoms. And often because the cancer is such an overwhelming issue, their menopausal symptoms might be neglected. So it's a really important thing to remember to address. So for some women, they're not able to have hormone therapy. So for example, if they've had breast cancer or some other hormone-dependent cancer, and it's important that they're aware that there are other types of treatments that can be used to improve their symptoms. But for some women, they can use hormone therapy, and it's really important to use this for women who do have symptoms or who are younger than the age of 50. The other important concern for a lot of women is fertility as well, and it's important to consider early referral to a fertility specialist so that they can discuss their options. They may have already seen somebody to discuss ovarian preservation before treatment. The Gene House website has lots of really good information that women can access, and it can be really helpful for doctors to direct women to this website. It contains fact sheets and really readable and understandable evidence-based information for women to read, but it also has some excellent resources for clinicians. So for example, linked on our website, you'll find the Jean Hales Menopause Tool, which has very straightforward information for clinicians. On there is also the Monash University Menopause Practitioners Toolkit, and both of those are excellent resources. Also on the website is more useful information for clinicians, such as validated symptom scales, which can be used to monitor therapy.